Good morning. My name's Sarah, and I'm going to be presenting for my group of Sutana, Ada, Lucian, and Brandon. We're talking about ethical dilemmas in nursing. So, what are ethics? Our textbook defines ethics as a system dealing with standards of character and behavior related to what is right and wrong. Then you have bioethics, and that deals with human nature and behavior, social science, the natural world. Um, Then you have nursing ethics, which is a subset of the bioethics. It is the formal study of ethical issues that arise in the practice of nursing and of the analysis used by nurses to make ethical judgments. So, what's an ethical dilemma then? An ethical dilemma, by definition, is a situation that arises when attempted adherence to basic ethical principles results in two conflicting courses of action. You have a problem, you have two different routes to take. You're going to have to decide how you're going to deal with this situation. Some ethical issues nurses commonly deal with in daily practice include cost containment issues that jeopardize patient welfare, beginning and end of life decisions, breach of patient confidentiality, and incompetent, unethical, or illegal practices of colleagues. What's a code of ethics? Broad definition is a set of rules about good and bad behavior. As nurses, we have a more specific code of ethics. It's written by the American Nurses Association. It's called Code of Ethics for Nurses with Interpretive Statements, which you can view for free at the ANA website. Um, the first formal code of ethics for nurses was adopted in 1950, although the need for a code of ethics was always there. And understood amongst nurses as far back as the 1800s. As it wasn't official or formal, but it's always been there. It establishes an ethical standard that is non-negotiable in all roles and in all settings. The code's written by nurses to express their understanding of their professional commitment to society, and it describes the profession's values, obligations, duties, and professional ideals. So this is just a list of the Code of Ethics provisions. You can find these on the ANA website. Provisions 1 through 9, definitely something that you want to be familiar with as it's going to pertain to your practice. So how is this information crucial to the role of the RN? The Code of Ethics is focused on practicing with compassion and recognition of dignity, worth, and qualities of every person. You're going to want to put the patient at the center of your care, advocate for their betterment. There are laws in place to protect the patients, like HIPAA laws, other privacy laws. But it's the duty of the nurse to keep patients safe from questionable practice or impaired practice. So this is just something you're going to be applying. It's something that you need to be aware of, and you need to know what actions to take. This code of ethics, it helps nurses with accepting responsibility and accountability for the patient. Yeah, it's your responsibility as a nurse to delegate appropriately, to always act ethically. Some more information about how this is crucial to the role of the RN. Of course, it offers guidelines, so you have something to reference. Of course, you have your general moral compass inside, but the code of ethics lays out a guideline for you to follow. It helps you improve the healthcare environment. Uh, helps you support the health needs of community nationally and internationally. The Code of Ethics does all of this, and it requires a profession to spell out nursing values. It requires you to uphold integrity and be professional at all times. Why is this relevant for level 1 students? Because who you choose to be on any day you arrive for practice literally has the power to influence how people are born, live, and die. Even when you're in clinical, if you're just doing hygiene care, whatever, You're still providing patient care. You still need to be aware of how you're acting, how you're talking to people. So being introduced to the codes of ethics early on can have a positive influence on the recognition of ethical content when you're in clinicals. And you also need to be aware that if you see something that's not right or that needs further investigation, you're going to report that to your nursing instructor. So you just want to be familiar with what's appropriate, what's ethical, and what needs to potentially be reported. So move on to our questions. How can cost containment jeopardize your patient's welfare? Resources are scarce, and it's brought a new appreciation to the meaning of cost effectiveness and placed a larger responsibility on nurses to advocate on the patient's behalf to obtain those resources. As nurses, we have to provide evidence of necessity using comparative evaluation of the cost and the consequence. Nurses are also a resource, and due to understaffing, allocated nurses based on a need and a patient acuity can be a challenge. So, you have to be mindful of how you're using yourself. You want to prioritize your patients appropriately. They unfortunately, sometimes we may be dealing with issues where the patient may not be able to afford the best treatment, or they don't have insurance, or they do have insurance, but their insurance doesn't cover it. And that's going to be difficult, but it's something that you're probably going to see, and you just need to be prepared of how to deal with that. Some other ethical dilemmas: beginning and end of life situations. What could we be faced with? Beginning of life, a big one is abortion. It has to have many aspects to be taken into consideration. There are religious, moral, social dilemmas. There are different laws in different states. It might not even be legal for someone to get an abortion. You need to recognize your own feelings on abortion and be sure not to let your personal views affect patient care. You need to remain neutral and be non-judgmental and provide the patient with support and guidance. Even though you may not agree with it, your job is to be there for them and not to judge them, and just don't mistreat anybody because of your own personal views. What about end of life? End of life decisions such as life support, foregoing medical treatment, advanced directives, and assisted suicide are all ethical dilemmas that nurses may have to participate in. You're going to have open, candid conversations with the patient and family, and that's crucial in providing patients with the care that they need. Ultimately, as nurses, we have to respect and honor the patient's wishes despite our personal views. And you may have a family member come in and this patient signed a DNR and that's what they wanted, and the family comes in, they're demanding you to do CPR. What do you do when you're in that situation? Ultimately you would need to honor what the patient, when he signed a DNR, he or she, when they were of sound mind. And that's, it's going to be tough, but you just are going to have to explain that. Okay, so how do professional and personal integrity affect nursing care? In the ANA Code of Ethics for nurses, it states that the primary commitment for the nurse is the patient, but it also states that nurses owe the same duties to self as to others. This includes the responsibility to preserve integrity, maintain competence, and continue professional and personal growth. Nurses' perspective and professional values affect decision-making and patient care. So do your personal values. I mean, ultimately, it has an effect. So we need to protect the patients who are vulnerable and unable to defend themselves against those who may try to take advantage of their weaknesses. We need to also keep our own biases in check, because like I said, you do have your own personal values, and those do guide us. But you just need to check your biases and make sure that you are remaining neutral when caring for a patient. and not letting those interfere with the care that you're providing. So what are some resources that are available to nurses facing ethical dilemmas? Well, first, you could always talk to your your nurse manager, an experienced nurse that may have dealt with this in the past. They may be able to give you some advice on how to approach the subject. If it's something tough to discuss with a family or something like that. Um, there's also a chain of command that you can follow if your direct supervisor cannot resolve whatever issue you may have. You can go right on up the chain of command all the way to the CNO. Your employer's legal department can also be an invaluable resource with faced with ethical dilemmas. They can definitely give you the legal aspect of it if it's to that point. If you're a member at the local nurses union, they can be helpful as well. And there's information um, available from various nursing organizations such as the ANA or the ICN. That's our little sideshow on ethical dilemmas in nursing. Thank you guys for tuning in and hope you all have a great day.